Okay, we know May is Mental Health Month. It's always a good time to talk about postpartum depression because we know that 1 in 10 women will experience postpartum depression after giving birth, and this can last anywhere from 3 to 6 months. And it's estimated that 50% of mothers with postpartum depression are not diagnosed by a health professional. It's a very serious situation. And I want to bring in right now someone to talk about it, do a deep dive here. Dr. Patrick Cleaton with St. Francis Medical Partners, OBGYN. Doctor, good morning to you. Let's talk about first off, the postpartum depression. How common is it when it comes to you and your practice here in Memphis in the Mid-South?
Well, you said it, about 10% of patients experience it, and not everyone comes forward to mention their symptoms. There can be a stigma around it, and that's one of the things that we're working to get around is being comfortable talking about it so that you can get help, because it's a very treatable condition.
Yes, sir. And so let's talk now about the signs and symptoms of PPD.
So the main thing is depressed mood beyond what's normal. Also feeling tired, which is pretty common during the postpartum period. But when it gets to that point that you're not able to do the things that you need to do, such as taking care of yourself, taking care of your baby, when those things start to feel like a struggle, that's when it gets to the abnormal. When you start losing interest in normal activities that you used to take interest in, like going for walks, when you start noticing disturbances in sleep, such as insomnia, sleeping all the time, just not feeling interested in things. And those are the signs. And when you start to not feel like yourself for an extended period of time, beyond what you would expect for just taking care of a newborn, then that's when it starts to become something that we need to address.
So when a woman comes into your office and you see these signs and perhaps symptoms of postpartum depression, what's the treatment that you recommend?
So there's really kind of 3 main things that we discuss, which is the first one is counseling. Just talking through some of these issues, working through some of these issues is usually the opening treatment, and not everybody wants that. So the next line would be using antidepressant medication. That medication is considered safe even if patients are breastfeeding, so it's a good option. And then the third option would be using both of those together, and that seems to get some good results for folks to talk about things and use medication to help level out their moods and address their symptoms.
So if there are perhaps people that are going to be expectant mothers or someone that's trying to have a baby, is there maybe some guidelines that you just kind of counsel someone that is trying to get pregnant? I mean, is that too early?
Well, one of the biggest risk factors is somebody who has a history of depression prior to pregnancy. They're potentially predisposed to having depression episodes in the postpartum. So that would be one thing that I would counsel them. If this is something you've dealt with in the past, depression, anxiety, you're concerned that your support network is not adequate, those would be things that I would want to address and make sure that we've gotten the support network, we've gotten a counselor on board prior to actually getting to that point where it's 4 weeks into the postpartum period and we're starting to unravel. If we can address these and get those things set up beforehand, obviously we're going to do better in the postpartum period.
Doctor, we have thousands of people that join us each and every morning on the Action News 5 digital desk. Is there anything else that you want to mention when it comes to postpartum depression, expectant mothers who have given birth, and May being, Mental Health Awareness Month?
Again, it's going back to what I said initially about the stigma. This is a very common thing. It's very treatable, and it's something that it does rely on the patient to bring these issues up, as we do ask about it during, of course, all our postpartum visits. But if you say, no, everything's fine, and just kind of gloss over it, then it's hard to know. It doesn't always have the outward signs like some of the physical things. But if we're able to have that conversation, then we can address these issues and we can get you back to hopefully being more of yourself and living your normal life sooner rather than later.
Okay, Dr. Patrick Clayton, OBGYN with St. Francis Medical Partners. Appreciate the conversation, sir. Thanks very much.
Thank you.